The National Center for Healthcare Leadership has sponsored the creation of a white paper with a proposed construct to unite stakeholders around a broad-based coalition, a broad-based pathway for healthy communities. So I'd like to start with an overview of that process and that roadmap from Jay Warden.
Yeah, this is an idea that that I've had I've been working as a strategy consultant, mostly with hospitals, health systems, academic medical centers over the last 15 years, and been in healthcare for 25 or so. And probably the day it sort of hit me was I was doing a strategic plan for a small health system in the Midwest, and we had done a focus group with a bunch of community organizations, law enforcement and public health and the local mental health facility and that type of thing, and they were all in a group, and we were talking about the health system strategy, and somebody said, well, you know, the health system does a great job of taking care of people, but there's nobody in this community that is really bringing us all together to talk about people's health. And so as I was thinking and spending most of my time helping organizations start ACOs and transition from fee-for-service to value-based care, started to think there's got to be a new construct, and started to try to think of some analogies, and came up with the Chamber of Health idea, thinking about the Chamber of Commerce as an organization that in any given community has competitors, but all stakeholders at the table in one organization focused on a single mission, which in their case is economic development and job growth, and in the case of the Chamber of Health would be health improvement for that particular community. One is that, again, single place where all stakeholders in the community around health improvement, not health care, but health and health improvement come together to focus on the community's needs. That would start with a single comprehensive community needs assessment. Right now in many markets, competing hospitals are doing multiple needs assessments, and there are a lot of great efforts going on at AHA and other places. We don't want to reinvent the wheel on how to do a community needs assessment, but making sure that we're looking at things like social determinants of health, looking at data sources that go beyond what you would typically look at when a hospital does it, and making sure that the voice of the community is heard as well. Dr. Wen mentioned the Baltimore experience of not only looking at what we think the community needs, but also talking to them about what they think they need. The second piece is really taking that needs assessment and with everybody at the table agreeing on what the priorities are for the community, what needs to be improved, again with that voice of the community, and identifying the metrics, specific metrics that need to be measured for those specific needs, agreeing as a whole on the needs and the measures, and then ultimately collecting data longitudinally. So one of the ideas around the chamber is not that there would just be one in one community, but just like a Chamber of Health or YMCA or other organizations like it, which are sort of a franchise model, there would be chambers all over the country that would ultimately network, have a single database, partner with a university potentially to research around, okay, what programs are moving the needle on what metrics. But the key thing, just like if you think about a church committee or any other kind of committee that you've been on, you don't want the loudest voice, the most aggressive personality, the person representing the biggest organization to dominate the conversation. And so part of what has to happen with this idea ultimately is leadership training around collaboration, so that the folks that are part of it in any given community are trained to collaborate and to lead together for a collective good.
Can this be done? And what will it take to move us beyond silos?
There's amazing stuff going on, but it's not easy. Why is it not easy? One, silos. This is my turf. It's not your turf. This is my territory. So one, you have an economic issue. You have to have stable funding. And that means everybody has to put some of their own money in. Second thing, just to follow up what Dr. Wen said, there's a lot of distrust out there. You know, the people from Memorial Hospital come tripping along going, hi, we want to save you. You're going, Which survey is this and which candidate is this for? There's a tremendous amount of lack of trust. The third thing is one of the mistakes that we've made in preventive health work is being extremely judgmental.
So you talked about silos and the challenge of silos. Let me go to you, Marvin, because your organization is about coordination. Tell me a little bit about how you're approaching bringing the relationships to the table that need to align to get this work done.
When HICCup, as it goes in and the Wellville community accepts us, I spend most of my time on the ground building rapport. And if I can't have dinner with you at your home, or if I can't invite the 2 hospital CEOs to come down and have dinner with me, then I'm not doing my job. So a lot of the work that I do is really about addressing ego, about addressing the business model, because at the end of the day, there has to be an economical movement and there has to be an understanding of territory and financial flow. But if we're not able to address the how can we break bread together aspect of things, then we can't go from what I call 0 to 1.
So a couple of questions for you. When you look at this concept, in some ways it could be like trying to solve world peace. So how do we overcome a myriad of obstacles and reach alignment around, whether you want to call it a tipping point or critical mass, from your learnings and perspective?
Well, first of all, at my learnings at the local level, you really do have to go all in. I mean, if this is going to be a serious effort across a community, it can't be something that runs in parallel with your community health department at your hospital. You have to throw your community health department into this so that there isn't a distraction, there is a commitment, there is the resource level necessary, and so on. You have to go all in. You have to be willing to take risks. You have to be willing to stand up to those who say, I built that program. What are you doing to it? Well, I'm building on it. I'm leading it to a new place. So my members, my former members, now that I'm retired, always wanted to know what we were doing on a given issue. And the hardest thing to explain was that we were part of something larger. Now, intuitively it makes sense, but politically, we didn't have front line, top line billing. And so they didn't think we were doing the job. Right now, not to upset anybody in the room, but you might have heard about a discussion about pharmaceutical pricing and a coalition that's pushing back. That's our answer at the moment. We're part of something larger. Look at what's going on. So you have to be willing to take those risks to your own standing and be able to stand up with that loud voice that the ambassador talked about and say, this is what needs to happen. This is what it's going to take for us to go all in to do this right. Who's willing to do it? And guess what? Back to my friend, he was willing to say, I'm first. That's strong leadership. That's commitment to something much bigger. At the moment, I love what we're doing and I love the focus on health, but I'm not quite sure that we have figured out that this is an all-in proposition.
There are a lot of micro initiatives and people do have the tendency to reinvent from scratch, and that's a pity because there is a lot to learn. A lot of progress is being made, and I was impressed, for example, in the white paper, this recognition that hospitals are doing community needs assessments. There's lots of community needs assessments going on in health departments around the country. We can improve on that by trying to bring that together into one process. So I think the more people do what HICCup did, which is go in, harvest what you can, think what you need to do differently for your local circumstances. Don't start from scratch. There's so many resources out there already.
Yeah, I want to comment on that. The other misconception is that one size fits all. And,
right. Not in America.
And one of the things that is the most difficult, in fact, one of the things I've asked, we try to do as often is we never try to go into the community without another partner, meaning like either Rick and I, or Esther and I, or Mario and I, because just ourselves will see something different in the conversations that we're having, or we'll project. We want to believe that this is actually going to be positive, or we want to think that this person, and this is the one that really kills me, that this person's really going to change and they're going to lead charismatically, right? And you really want to believe them, and they're going to say all the right things. They're going to use all the right words, and then, a month goes by, 6 months go by, 8 months go by, and they're still in the planning phases, and they're still talking about the thing that they're going to talk about, and a year has gone by, and that's the part where, you know, Esther's been critical and just saying, look, we're just going to go in there and really lead by example and set that tone. And so I talk a lot about cadence and direction, but yeah, it's you know, knowing how to listen to what other people have done, but also knowing how to see and be objective about what you're seeing.
Thanks. I want to just give a quick story about Detroit, because in many ways I think that the fall of Detroit is probably the most profound example of population health failure. Because in many, many ways the fall of Detroit was related to all the elements that we're talking about that really are required to have a healthy community. So it was the failure of education, the failure of job creation, the failure of alignment. It was a series of failures. During that whole time of the fall of Detroit, it wasn't that there were any lack of very, very well-intended organizations that were working really hard at creating some improvement in one of these paths, but they didn't have enough energy or clout or power to stop the downward spiral, you know, that was going on. And our organization was one of them. We worked just in enormous ways, and we made a difference, but it wasn't enough to reverse that trend. But now the rise of Detroit, and Detroit's really hit a very, very exciting, you know, tipping point where there's just unbelievable evidence that it is really moving to reclaim its presence in this country, and it won't be a quick journey, but it's well on its way, is because of the alignment around a population health approach. It's not called that. No one thinks of it that way, but it is all those energy forces aligning and attacking it in all angles: job creation, education, crime, race relations, health status, disparities. And it's amazing to see the power of that alignment when all of the forces start working under a coalition. And it all started with leadership, to the point. So back to the Chamber of Commerce concept, does that construct help us cultivate the leaders that are going to be necessary, or identify the leaders? And if not, what does?
That leadership, that leader, right? That's why the Marine Corps is so powerful in accomplishing its mission. That leadership has to be well defined, and it has to really, really direct the personalities and the rules of engagement, so to speak. And I think that the Chamber can do that, right? It can set up a mechanism in which people are a little more normalized in what they represent or what they're doing. And that way everyone gets a little bit of a more equal voice, because sometimes the brands or the money speaks loud.
It's really hard when you bring people together, lots of people together in a coalition, is we even speak different languages. It's been mentioned we have different incentives and different measures, and I get paid differently back home on different measures than you get paid, you know, and so on and so on. One of the things that is very early on that I'm very interested in, and they're still looking for their first community, so this is not proven, but there are a couple of former Baldrige recipients who are coming together to try to take a combination. You know, the Baldrige criteria focuses originally on business and manufacturing, then on healthcare and higher education, then on community services and government, and trying to see if they can't put together a common framework and a common language called Communities of Excellence. They're trying to get this done over 10 years. And it's something I think to watch, because it gets us all out of our language, out of our measures, toward a more common understanding of how we're going to do this together. Something to think.
Leadership can come from anywhere. Leadership can come from anywhere. How are you going to cultivate them? Find them. Find them, and if you need to help with education, if you need to put them through, you know, MHA school, whatever. But these people can be identified. This is a bunch of Ugandan grandmothers raising orphans. Leadership can come from anywhere. Okay. Don't pre-assume.